as Paul mentioned, I'm Shiloh Matthias, Business Development for AWS's Customer Data Apps. And if you were in the earlier TikTok session, you know I like travel, cats, and tinted face serum. Stephen, can you tell us a little bit about yourself and your background? And then we can, actually, before you do that, let me just give you the high level of what we're going to be talking about today. So Datavant and AWS have just announced a really exciting initiative for healthcare and life sciences customers that enables compliant use of real-world data to help drive advertising use cases. So Stephen, let's kick it off. Tell us a little bit about yourself professionally, and then, of course, personally, too.
Awesome. So I'll start with personally. A couple fun facts about me. I play the banjo. Used to perform in a bluegrass band. What else? I got back to New York last night from Armenia. So I'm wearing my pin with Armenia here on it as well. And professionally, I have been at Datavant for a year now. Prior to that, I spent almost 5 years at LiveRamp, where I know you spent some time as well. That experience enables me to wear 2 different hats at Datavant. So one hat that I wear is as an internal partner, helping both our life science direct as well as our ecosystem sort of platform sellers to scope and facilitate advertising workflows. And the other hat that I wear is as the privacy specialist. So helping to put a privacy and compliance wrapper around those workflows to enable HIPAA as well as GDPR compliance, HIPAA being the main federal law that has to do with governing health data.
Awesome. So 2 jobs in one. I'm sure you appreciate that. And so for those that might not know Datavant, can you give us a little bit of background on the company and the value you bring for healthcare and non-endemic advertisers as well?
Yeah, absolutely. So some of you might be thinking, okay, I'm not in healthcare. I don't deal with health data. And maybe you should. Maybe there's a way that you can incorporate that. So Datavant is truly data logistics when it comes to connecting the health data around the world. And so the main goal here is connecting that data to improve patient outcomes. But what does that actually mean? So we maintain an ecosystem of around 500 different partners that operate on the Datavant token, but those partners include real-world data sources. So real-world data, what is real-world data? That is basically any data that's generated in, you guessed it, the real world, not in a clinical or a controlled research setting. So this can include claims data, it can include specialty pharma data, it can include social determinants of health, which is just a fancy way to say demographic data, all of the above and so much more.
Awesome. And I mean, it sounds like a really powerful data asset as we think about healthcare marketers who have both clinical use cases, such as research and development, but for the audience here, can you talk a little bit more about the commercial side, advertising use cases, and in the status quo today's world, how they're utilizing Datavant and your real world data for that?
Absolutely. So you can put this into 3 different buckets. So these 3 different buckets that Datavant enables on the commercial side, i.e. the advertising side, is number 1, data access through that ecosystem of real-world data partners. Number 2 is control and transparency so that our brand partners no longer need to rely on third-party entities in order to do their audience modeling or audience campaign measurement. And then number 3 is around improving performance. So marketers that use row-level data, I should say compliant row-level data, often report up to 10x increases in performance.
Awesome. So, okay, if I was listening carefully, access, transparency, and control, which sounds like a marketer's dream.
Totally.
And so as we think about the status quo and then also this announcement that AWS and Datavant are creating something new, tell us a little bit about that and kind of where you're heading in terms of what you want to enable or what we jointly want to enable for healthcare marketers.
Yeah, absolutely. So I'll start with the 4 areas that we support brand marketers today. And we also do this on the platform side. So if you're on the platform side, you don't feel like we're leaving you out. But it starts with audiences. So audience creation, audience modeling. Number 2 would be audience quality and analytics. You want to make sure that these are actually the right people that you want to target. And then number 3 would be outcomes measurement. And then, of course, number 4 is the privacy aspect. And we enable all of this. Datavant, as a neutral ecosystem partner, we don't do measurement. We don't do analytics, but we enable all of that. We do the privacy and compliance part to help everyone out. When it comes to this partnership with AWS, now what's really cool here is that the vision is that we're enabling the discovery and the evaluation of real-world data assets without data movement. So today we heard a bit about AI, we heard a bit about clean rooms, and this is sort of touching on the clean room aspect of the evaluation of this data without data movement. Now, why is that important? There are a lot of barriers to the use of real-world data, especially in commercial and advertising use cases. The barriers can include hesitancy from data ethics or compliance departments, legal departments. It can also include really the back and forth nature of the evaluation process for real world data. And the real game changer here is both for data providers as well as for the data buyers. Now you'll be able to list and register your AWS stored data sets in the Datavant platform, perform overlap analyses, as well as then run queries against that data, interrogate metadata, and all of this is done without actually needing to talk to a person yet. So to give a quick framework of the big difference here, previously both parties, a data buyer and a data seller, would have to upload their data to the Datavant platform. That's how people are doing it today. You run an overlap analysis, and then when you've got enough of an overlap, you reach out to the partner. Let's say in this case, you're the marketer. You reach out to the data provider, and then it starts a string of emails that might not be answered, or you schedule calls that may or may not move things forward. And now you'll be able to, in contrast to that, accomplish so much with respect to the evaluation and choosing of those data sets without having to A, move any data, or B, talk to a person unless you really want to.
I love that, personally. I mean, I know I've been working with Datavant on this, but I mean, it sounds really transformative. I mean, for those that might not be as familiar with the healthcare space, do you mind taking us through an illustrative example for a pharmaceutical type brand? And you don't have to name names, but just to kind of put it into perspective for the audience.
Absolutely. So let's say you're an advertiser and you're bringing a new rheumatoid arthritis drug to market, or a new heart disease treatment, or a GLP-1 for weight loss. So you probably have some consented first-party data. You probably have some modeled data that you'd be using for targeting. At that point, you run your media, and now you've got impression logs. And then what you also need in order to really complete all of this would be the outcomes data, which often is claims data, can also be labs data. This is where the ecosystem of data providers come in. Now, what's really cool here is that we can tie all of these different data sets to either a Datavant token or the identity of your choosing. If there's another advertising ID that you really like, we can bridge into those. And now, in-house, you've got the ability to do your outcomes measurement, optimize those campaigns with your own hands on keyboard, or have your agency run them. And yeah, that's what it sort of looks like.
That's great. And from a timing perspective, what are we looking at here? When will this be available for healthcare marketers to test out?
So the MVP is in process right now. That's a closed MVP, but we're very excited to make the announcement on December 3rd at AWS reInvent. And we are looking for partners to participate in our public preview, which is going to be in Q2 of 2025. So if you're interested, if you're curious, talk to us, talk to Amy over here, and also you can reach out on our website.
Awesome. Thank you. So I know we stand between you and happy hour. We are happy to take a couple questions if there are any questions. Or, as Stephen mentioned, Stephen and Amy from Datavant will be at the happy hour, so you can come in and find them and ask them questions after. Any takers?
Is anyone here in healthcare or life sciences? All right, we got one maybe. Excellent.
Well, we really appreciate the time and hope to chat with everyone at happy hour.
Thank you.